Good afternoon, members of the media. Thank you for joining us for this virtual press conference that we're holding jointly with major healthcare systems in Maine. Before we get started, I'd like to go over a few ground rules with you for how this goes. I know a lot of you have actually been in these virtual press conferences, but some of you may be new. And so the first order of business I have before we get started is I'd love for each of you who are here to do me a favor and rename yourselves. If you're not named by your media organization and then your name, please do so. So example, if you're Joe Lawler with the Portland Press Herald, it would be Portland Press Herald Lawler. We've got a lot of people here, media representatives and guest speakers, so it will make it a lot easier for me as the facilitator of this meeting if you're named that way. So when I go through and select you to answer or ask your questions, I can find you that much more quickly. Again, welcome to our virtual press conference. We have four of our leaders at our health systems that will be making some statements to you today, and then we'll take questions. There's a little bit of noise in the background. If you could mute your mic, if that's in your background, I'd appreciate that. Again, we have four speakers for you that will make some opening statements, and then we'll take it for questions. And what I'd like to do is go down the list of media organizations here and give you an opportunity to ask two questions, and then we're going to move on to the next media organization. We've got a lot of you here, so it may take a while to get through this list of questions, but this is the order we're going to go in. We have excuse me for a minute. It's Portland Press Herald. We'll have Joe Lawler, Blake Lipton from WVII, Sam Rogers from News Center Maine. We'll have Kate DeGroot from WGME, Jessica Piper from Bangor Daily News, Charlie Iacker from Maine Public Broadcasting, Patrick Whittle from Associated Press, Bill Herksgård for WMTW, Fran Gonzalez from Village Soup, Emily Bader from Sun Journal, WABI, and Amy Brown from WERU. And so that's the order we'll go in. If you would like, in some cases, we have offered videos in the past. We're going to, since we have four guest speakers on four different Zoom accounts, we're going to ask that if you want a copy of this to record it. We are going through, I've got staff right now that should be going through right now and giving you permission to record. If you do not have permission to record this and you'd like to do so, please use the chat window, and one of our staff will make sure that you have permission to record the press conference. Again, we'll start with some brief statements from our panelists here, and then again we'll take your questions. So the panelists are Dr. James Jarvis, Senior Physician Executive Incident Command Northern Light Health, Dr. Joan Boomsma, Chief Medical Officer, Maine Health, Dr. John Alexander, Chief Medical Officer for Central Maine Healthcare, and Dr. Stephen Diaz, the Chief Medical Officer for MaineGeneral. Also in attendance, we have Chris Laird. He's Associate Vice President of Patient Care Services at Northern Light Health. He's a critical care nurse and can certainly answer any questions if you have any of the direct care workers on the front line as well, but won't be making any statements. All right, so with those ground rules kind of laid out for you, let me just check really quickly with my team and make sure that everybody who has permission to record does have so. And then we'll get started. So Dr. Jarvis, give me just 1 minute.
Chris, there are a few other names that have recently jumped on as well. Just want to make you aware.
For media?
Yes, I sent them to you via text.
Okay, I'll get to those. I'll get those new media. Give me 1 second. We'll make sure everybody who's on the call gets a chance to ask their questions. So we'll also have Steve Portal from Seacoast Online and and Kevin Fowler from WMTW. Okay, Dr. Jarvis, without further ado, I think I'd like to let you get started, and then we'll move down the list.
Thank you, Chris, and thank you to the members of the media who were able to join us this afternoon. This is a very important subject matter that we need to talk about, and each of us will in turn talk a little bit about what's happening across our health systems and then provide some brief remarks. So I'll get started. As of this morning at Northern Light Health, we have a total of 46 patients across our system who are inpatients and positive for COVID-19. 2 of those are at A.R. Gould Hospital. 32 of those are at Eastern Maine Medical Center, 1 at Inland Hospital, 2 at Maine Coast Hospital, 5 at Mercy Hospital, and 1 at Sevasticook Valley Hospital. In addition, our home care and hospice team are taking care of 3 patients positive for COVID-19 at their homes. We gathered today because we've reached a critical moment in the pandemic, and what Mainers do moving forward will determine what happens next. Throughout the pandemic, Mainers have truly led the way. We have one of the highest vaccination rates in the nation, and our case numbers have been lower than most other states. But the situation has been changing here in Maine, which mirrors what is happening elsewhere in the country. As you know, cases and hospitalizations have been on the rise, and this is having a real impact on Northern Light Health and all of Maine's hospitals and healthcare systems, and most critically of all, of every community in Maine. Today, we are encouraging Mainers to do the things that we know can make a difference in reducing the impact of COVID-19. Get vaccinated if you're eligible, wear a mask indoors, practice physical distancing, clean your hands, and use careful discretion when it comes to attending indoor gatherings. And with that, I'll turn it over to Dr. Boomsma.
Thank you, Jim. And I'd also like to thank all of you for joining us this afternoon. I also want to, first of all, thank all of the frontline healthcare workers across our state for everything they've been doing over the last 18 months. They are truly heroes, but they are also exhausted. And we need your help. We need everyone to help us stop this pandemic. As Jim said, we need to encourage people to get vaccinated, and to wear masks indoors, to avoid large gatherings. Like Jim, we're seeing an increase across Maine Health in COVID cases. We're averaging about 35 patients in the hospital a day. Over half of those at any point in time are in the ICU. And unlike previous aspects of the pandemic in Maine, almost every day we have young children in the hospital with COVID. We have almost as many patients in ICU beds across the state of Maine currently as we did during our peak last January. But it's not just our ICUs, our hospital beds are full. I think it's a combination of seasonal increases along with the increased volumes of COVID patients and staffing shortages. Every day across Maine Health, and I know my colleagues see some of the same, we are holding patients in our ERs because there are no beds to put them in. I just want people to realize that, you count on all of us to provide care for the most serious illnesses and injuries across the state. And the more COVID we take care of in our hospitals, the less resources we have to take care of all of those other things that we need to do. So we're asking all Mainers, if you're not vaccinated, please get vaccinated. If you are indoors, please wear a mask, even if you are vaccinated, and avoid large gatherings. Do it for yourself and for your neighbors and your families, but please do it for us as well. Thank you.
Thank you very much, Dr. Boomsma. Dr. Alexander?
So I also want to thank everyone for joining on this call and for participating in this conference. I think it's really important for us to come together as a healthcare community and as a state. As Jim described, we have tried to lead the nation in terms of getting the message out there, to acting with one voice, leading with vaccinations, leading with testing, and we have to continue to do so. Like my colleagues across the board, we continue to ask people to be careful, to use diligence, to wear masks, to protect each other and protect themselves. We continue to ask people that can get vaccinated to please get vaccinated. You know, I had one of our physician leaders reach out to me just moments before this conference with just something that I want to share with everyone. He said, 1 year ago, healthcare workers were considered heroes. Nothing has changed. These women and men come every day to work to keep their community healthy. Despite their own personal beliefs, we owe them a debt of gratitude. I think if we can all just remember that the people, not just in the healthcare industry, but really all of the frontline workers have really struggled and toiled through this entire 18-month period. And let's keep them at the forefront of our mind. Thank you.
Thank you very much, Dr. Alexander. And Dr. Diaz?
So thank you very much, and thanks everyone for joining the call today. We're at a crossroads, actually, that has been spoken about a little bit, but like all of my colleagues, our hospital is full. And it's not due to acute COVID cases, but we're full because the COVID pandemic has affected our ability to have partners who take our hospitalized patients to have beds open, nursing homes and others. So everything is just chock full. And then the upstream from that is the emergency departments. The patients there have nowhere to go, so our ERs are overfull. And adding to that is that the pandemic has also heightened those with behavioral health needs. And before the pandemic, those resources were stretched. So the compilation of not having the people we need, staffing and or sickness and or the nursing home challenges has created a very, very jammed up system. The other part of the crossroads, though, is it's the end of August and school starts very soon. The best thing for our communities is to have children go to school. And so you have a lot of energy around what does that look like? And just to reiterate the points that are made, the way out of the global pandemic is not by one special thing. The way out of a global pandemic from a public health perspective is that we have to do everything until we see the numbers get better and we have some sort of ability to understand how the virus acts. The Alpha variant that started the pandemic is much different than the Delta. As Dr. Boomsma said, we have much more pediatric patients getting the COVID infections and spreading it, and they do not yet have a vaccination. So to put a finer point on it, we need everyone to please get vaccinated for the health of the community. We also need to wear masks inside, social distancing. Please stay home if you're ill, and support those around you by everybody participating in the process. It's easy perhaps to think about, well, this will just pass and this is just another thing. And the answer is viruses are as varied as there are mammals. So just because we know how the flu acts, we can't assume that we're going to know how the COVID-19 acts or will evolve over time. So as all my colleagues have said, we are very thankful that we're able to provide healthcare here in the state of Maine. We have great people doing great work, and we need now a continued focus because we have not gotten in front of the pandemic. So if everybody could please listen to what we're saying, it'd be great to help us get capacity back in our acute care facilities and our outpatient facilities to continue the quality healthcare we've delivered over time. And with that, I'll pass it back to you, Chris. Thank you.
Thank you very much, Dr. Diaz. At this point now, we'll turn it over to questions for reporters. What would be helpful is if you let us know or let us know who you're directing the question towards. Again, we're going to start with the Portland Press Herald, and it's Joe Lawler who's going to be answering questions first. Joe Lawler, you can go ahead and unmute yourself, Joe, and then ask your questions and let us know who you're directing it towards.
Yes, hi, thanks for taking our questions today. I guess I'll direct this to Dr. Boomsma, but it's really to whoever wants to weigh in. I'm wondering, you're sounding the alarm here, and I'm wondering how close are we to really running out of room? Like if we see another 20% increase in case counts, and I know that leads to hospitalizations later, are we talking like what we've been seeing in other states? Or would it have to be higher than that? Just how close are we to a very critical point?
Thank you for the question, Joe, and my colleagues may want to join in, but when I look at the fact that we are currently today holding 50 patients in our emergency department who should be in a hospital bed, we're very close. We don't have a lot of other tricks up our sleeve or other places we can put patients. And when the ERs are full of patients who need to be in the hospital, it means our ability to take more patients into the ER is compromised. So we are full. We have a small amount, maybe 30 beds or so of ICU capacity. I heard this morning across the state. But again, it's not just about the ICU, it's about, general care as well. So, there's not a lot more that we can do to make more capacity in our hospitals. And so all the more reason for this opportunity really to have this conversation, because I think after a couple of surges, people may have gotten a little complacent, but this is having a huge strain on our hospitals right now. And we just don't want to be in a position where we can't provide the kind of care, COVID or non-COVID, that our neighbors and communities need.
And Joe, do you have a follow-up question?
Yes, my follow-up question is, I'm wondering, and I'll direct this question to Dr. Diaz. But I'm wondering, the healthcare system, has taken some criticism for, the state, I should say, has taken some criticism for, and I guess healthcare networks as well, for mandating the vaccine for all healthcare employees. And I'm wondering if you think it would help with vaccination rates, and also just to make things more universal, if we had more business sectors mandating vaccines for continued employment. How would that help the pandemic, do you think?
That's a great question. So the problem that we're having is that we thought that with a high vaccination rate around 80%, that we would have some sort of herd immunity, or the ability for the virus not to take off, if you will. But given the fact that it's so much more infectious, the Delta variant, than the Alpha variant, and that it's also now targeting more ubiquitous age groups, that is the younger age groups, that theory doesn't work. And so the more vaccine that people can, the more people can become vaccinated, stops the variants from evolving. The host that is needed for the coronavirus to continue this evolution is the human host. And the way to stop that evolution from occurring is to be vaccinated. So the more tools that we have to get the community vaccinated overall is the best way out of the global pandemic and its effect here locally in Maine. So I would applaud anybody who's able to step forward and have the ability to have their teams and communities vaccinated, because that really is one of the key tools amongst everything else for us to get to a steady state that allows us to go forward and have more social events and do things that we need as humans to feel whole. And so, yes, I would applaud the ability for businesses to look to themselves to help encourage vaccinations.
If Chris isn't able to take over, can one of the other comms people please?
Sorry about that. I didn't realize I was still muted. Blake Lipton, you're next up on the list. Blake, when you're unmuted, please ask your question. You should have permission now, Blake. Okay, Blake, if you're having trouble, just let me know in the text box and we can get back to you. I'm going to move on to Sam Rogers from New Center, Maine. Sam, you should have permission to ask your questions now.
Oh, there it is. Sorry, just saw the notification. Thank you for giving me a chance to ask this question. I know it's been brought up a little bit here, and a little bit, I know Dr. Shaw mentioned something on Twitter earlier about the staffing at hospitals is a concern right now. Maybe the physical ICU beds isn't as much, what is the level of concern across our healthcare systems come October 1st, when healthcare workers who are unvaccinated obviously cannot maintain their position, and hypothetically there will be less folks to work? Is there a serious level of concern that once that mandate becomes in effect, that the staffing issue will dramatically increase?
I'd be happy to start. With the very high rates of community transmission right now in Maine, part of our shortages are that we are losing staff because they're infected with COVID. So right now we're losing them to the virus, not to the vaccine. And we certainly believe that that reinforces why we need to have all healthcare workers vaccinated to protect themselves and to protect our patients and communities. It is certainly our obligation to create a safe environment for all of our patients and care team members. And it's part of our mission and vision to create a healthier Maine.
Yeah, I just want to echo what Joan said. Northern Light, same issues. We see unfortunately our staff members and providers out due to infection or exposure. None of us wants to see anyone leave the healthcare profession. And what we want to do is we want to see that those who remain in the healthcare profession are safe and they are protected, and that we protect our patients. And that's why vaccination is so important. We have vaccinated against other communicable diseases in the past, and we will continue to do so. And this is just one other effort there. Maine has always had an issue with healthcare worker shortages. That is just the fact of life that we all deal with. And it does affect us on a day-to-day basis. And we will all continue to strive to do what we can to take care of all Mainers as best as we always have been. But this adds an unnecessary burden to us if we have unvaccinated individuals who need our attention for COVID-19.
One other vantage point, though, is even before the mandate putting more pressure there, the pandemic itself has had frontline workers reevaluate whether or not they want to work for healthcare systems. Our frontline staff, our medical assistants, certified nursing assistants, our patient reps, those positions for MaineGeneral have become very tenuous over the last few months, even before the mandate. So you want to, as Dr. Jarvis was saying, before the pandemic, it was a struggle. Now with the pandemic, we had frontline worker struggles. And now with the mandate, we have another cross-section of workers. So I think we're all feeling the workforce issue as really heightened, and with no end in sight, yet the mandate is the right thing to do. So we need to work through that. But we do feel the workforce issues palpably, I think, each and every day, and it'll be that way for a while to come.
Sam, do you have a follow-up question? Okay. I'm going to move on then to Kate DeGroot from WGME. Kate, once you see that you're unmuted, please ask your questions. One thing, folks, so we've got a pretty big list of people, so it's going to probably take me a little time sometimes to find somebody.
Hey, Chris, I don't believe Kate DeGroot has any questions today.
Okay, great. We're going to go to Bangor Daily News. Next up is Jess Piper. Karen and Andy, if you can also help me looking for people, and I'm muting, that might make it move a little quicker. Jess, you should be able to ask your questions now.
Yes, thank you, Chris, and thank you to all of you for being here today. I wanted to first ask, and I don't know if each of you can maybe answer this quickly for your own hospital system, but how is the state doing on pediatric ICU beds? And are there enough beds for kids right now who are sick with COVID or need to go to the hospital for something else?
So I'll start. Pediatric intensive care beds are always at a premium in the state of Maine. We only have a handful of specialists. They are wonderful people who dedicate their lives to taking care of young children. And we only have so many beds that can manage those. So the problem that we're having right now is we're needing to use those beds to take care of some adults who have critical care needs, because we have so many of those. And so that makes an even bigger challenge for us. So yes, the concern is real that if we were to see a significant spike in children who required critical care, whether that be for COVID-19 the RSV virus that's spreading rapidly now, or for any other indication. Our hands are tied, and it makes it incredibly difficult for us to take care of our most vulnerable population.
Yeah, I would say the same at Maine Medical Center in Barbara Bush. You know, we currently are able to take care of the children that we need to, and we do flex from adult to pediatric where possible. Maine Medical Center has opened 10 extra ICU beds over the last couple of weeks for adults. But you know, it's a challenge when you're running virtually 100% full all the time.
Okay. Do you have a follow-up question, Jessica?
Yeah, and just following up on that, kind of what is the capacity of hospitals to add new beds at this point? You mentioned, Dr. Booms, that you guys just added 10 new beds. Is that kind of the maximum at this point? How difficult would it be to add additional ICU beds right now?
Well, I think we're having those conversations internally. Part of the challenge is staffing, right? And having the skills that we need in our critical care, nurses, respiratory therapists, and others. We always, have the ability to flex, during the early surge. We opened some of our recovery room beds to ICU. So we're looking at every possible contingency we can. But the real shortage and the real limitation will be some of those highly trained staff that we need to take care of the most seriously ill patients.
A follow-up on that for MaineGeneral. Early on, we took our inpatient rehab unit and cut it in half and repurposed those beds to med-surg beds. And as Dr. Boomsma was saying, we did the same thing. We surged in areas that were able to have physical beds and cohort patients in order to take care of them at the level of care that's appropriate. But at the end of the day, the thing that really holds us back from doing more is having staff. And then the consistency of hiring somebody. No one wants to work for 3 months and then look for another job, perhaps. So the sustainability of the model during surge times is a challenge on many fronts. But I echo what Dr. Boomsma said.
Okay, thank you, Dr. Diaz. And thank you for those questions, Jessica. Next up is Charlie Layacker from Maine Public. Charlie, you should be able to ask your questions now. Please let us know if you want to direct them to too.
Sure. Yeah. Thanks, Chris. Am I coming through?
Yep. Can hear you loud and clear.
Yep. I guess really this would be for all four, or if any of you want to take it. Just can you provide any sense of scale of the capacity you're at now versus what you were at during past surges? I guess in particular the one last sort of December, January, that territory, in terms of like how many ICU beds you have available, how many ventilators you have available. Do you have any specific numbers you can give for your systems on that?
Yeah, I'll start. So not specific numbers, because as Dr. Boomsma said, we as a daily basis flex our numbers up and down. We have capabilities to do that, and all of us have needed to do that, and in hard times, regardless of the pandemic. The pandemic just makes it that much harder for us to do. And so on a daily basis, we will convert a medical surgical bed to an intensive care bed, and vice versa if we need to. We can use our recovery areas from our operating rooms, but all of that just takes away from what we would normally be taking care of. And I think that's really what the message we're trying to say is. None of us are at the level that we were at last November, December, January, but we don't want to get there either. Because we want to continue to remain open for the people who need us the most, those that are victims of car accidents, those who are having heart attacks, women who are in labor, and children who need us as a matter of course. And that's why we're asking for the assistance for the public right now, is to help to keep us so that we can continue to take care of you.
Anybody else care to answer, or if not, Charlie, do you have a follow-up question that you'd like to ask?
Sure. Yep. So the other question is just what other tools, and again, this could really be anyone, so I guess it's whoever wants to take it. Sorry, I can't be more specific, but like what else do you have in your surge plans? In particular, I'm wondering about setting up like an auxiliary center in Bangor or Portland, or even having a quote unquote ration care. Like are any of those things you're looking at, or are there other things you might have to do if things keep getting worse?
From a high level, I would just say, this is Steve Diaz. We don't have the staff to do that. So all the ideas of more capacity, physically creating space, you're going to draw from Peter to pay Paul. So I think the very the reason that we're so happy that you're listening to us today is that we are chock full and struggling with staffing. There are many reasons for it now that I spoke about earlier. And so the solution has to be a public health measure of making everything safer so we can get the numbers down and provide the healthcare in an appropriate way. So my 2 cents is building the physical plant isn't going to solve the staffing issue.
Yeah, the only thing I would add is, one of the few levers we have is to start limiting elective healthcare. And part of the reason we're so full now is we're still catching up. Maine Med has been full enough, and Jim, I'm sure at Eastern Maine too, that some days we've had to postpone surgical cases. If we need additional staff or we need to repurpose beds, about the only way we can do that is by canceling or eliminating really important other medical care that can be postponed, and that's not good for anybody. So we have all of that in our plans should we need to, but as Jim said, we're hoping that we can begin to mitigate that now before we have to start calling up people and saying, we're canceling your mammography, we're canceling your colonoscopy, we're canceling your hip surgery, because that's where this will go if we can't start seeing a decline.
Hey, Dr. Boomsma, thank you for that answer. One quick point I want to remind the media of. We do have an ICU frontline provider here today. If you have any questions, I know some of you have asked, in the past, if you can talk to somebody who's on the front lines, and we do have Chris Laird available too. So if you have any questions of him, he's in ICU. He works in ICU as a provider there. He's certainly a resource for you as well. I do want to follow up with a quick question from Sam Rogers from New Center, Maine, that he shared with me via text. He had an issue unmuting himself, but his other question, and this is directed to the group, so whoever wants to jump on this one first, is last year the Cross Insurance Center and other buildings were being prepared to hold extra beds. Is that in the works now?
I'll specifically talk about, here in the Bangor area. Off to my side here is actually the blueprints for the design of what we would do for an alternative care site. We don't want to do that. We want to do everything we can to take care of people in the best locations possible, which is our hospitals across the state of Maine. Expanding out or adding beds is not our issue right now. If we were to do that, we wouldn't have the staff to take care of those individuals in that particular location. And so that's really not our primary concern. While we have those plans in place and certainly can start talking about ways that we can do that, as we've seen around the country, that all that does is kind of spread out staff even further and hinder their ability to take care of the individuals who need the most. And so we will try to, just like we did last winter and fall, was try to avoid the usage of those kind of facilities. So we will just continue to try to manage the patients as we can.
Okay, and anybody else care to answer that? If not, I can move on. Okay. Next up, we have from the Associated Press, Patrick Whittle.
Thank you very much. Sort of following up on some of the things that folks have been talking about sort of earlier in the in the Zoom here. There is today a group of sort of activist groups and other organizations announced a sort of an effort against the state's vaccine mandate for health workers. And I guess I would like to get an idea from your organizations where you all stand on that.
Well, we certainly know that there are groups that are opposed to the vaccine mandate. If you're specifically referring to the group that we've read in the press, maybe suing the state or some of our organizations. We have no additional information on that at this time. Our legal team is awaiting any confirmation of that complaint. But we stand by our decision, as we've already discussed, to vaccinate all of our care team members in the interest of protecting our patients and the public health in Maine.
And Patrick, do you have a follow-up question?
I think it would also be I guess it would also be good to get a sort of an idea more broadly of the role that mandates in and out of the healthcare system need to play to sort of get the virus under control in the state.
And do you have anyone specific you'd like to answer that, Patrick?
Anyone who's willing to talk about it.
Well, I think as we've said, it's certainly our preference to inform people about the vaccine, to correct any misunderstandings, and to encourage people to get vaccinated voluntarily. Historically, as Dr. Jarvis said earlier, the state has mandated certain types of vaccines for healthcare workers in the interest of public health. So mandates of that sort have always played a role in keeping healthcare places safe.
Okay. All right. Thank you very much for your questions, Patrick. Next up, we are going to move now to Phil from WMTW. Phil, when you have should have the ability to ask your questions now.
Okay, no video, that's fine. I don't need to see my face. Good afternoon, everyone. It's an interesting assemblage here to see all of you together representing, at least the top 10 hospitals in the state and hospital beds, and 75% of the doctors work for all of your organizations. I wondered if you wanted to take this opportunity to go beyond asking again and again and again for people to please get vaccinated. If you think from a public policy standpoint, as leading healthcare professionals in this state, the only one who's missing is Dr. Shaw and Commissioner Lambrou, perhaps, from this panel. As in your positions, do you think that other professions besides healthcare need to have vaccine mandates? Governor Mills has declined to speak on that. Do you think that other employers besides healthcare and higher education, we surveyed 24 this week, only TD Bank has a vaccine mandate and not until November. Do you think other Maine employers need to have vaccine mandates? And finally, what about schools? They're debating whether or not to even wear masks indoors. And I thought from the guidance from healthcare professionals is well beyond that, but schools start next week and many districts seem to not be on board with what you're articulating. What do you guys need from public policy, for other professions, from schools, and from employers regarding the vaccine mandate or anything else?
So Phil, I'll start with the answer about schools. Northern Light Health has certainly come out with a strong position that we feel that that schools should require masking of students, staff, and teachers while indoors during the school year, and we've made that perfectly clear, and we continue to advocate for that. As far as mandates for vaccination, that really has to be an independent choice of those particular professions. We certainly encourage employers to encourage their staff and employees, customers, clients, and students to get vaccinated and offer any opportunity that they can. And if that means giving them time off from work to go and get vaccinated, we applaud that. Each and every one of our organizations has assisted in vaccinating outside of our own organization, going out into communities, setting up pop-up clinics and doing those kind of things to get vaccinated. And we continue to feel that the best way for vaccination to occur is through education and people to voluntarily accept the vaccine. It's some uniqueness in the healthcare profession. We are the ones taking care of everybody else, and therefore we cannot be part of the problem by spreading an infection, and that's the reason why we put all of those precautions that we have in place at each and every one of our facilities, and that's why we supported a mandate for vaccination for healthcare workers.
I like the provocative question only because it's at the root of the whole pandemic globally. I think back to a year ago when the meat processing plants had massive outbreaks because people were working in closed spaces, close together, if one person brings in the coronavirus, given the way it acts and has a threshold, and then more severe illness with more people who spread it, it's a time bomb. And I think that one of the issues we have is that there's a lot of misinformation about how safe the vaccine is, and how the technology, we're so fortunate to live in 2021 where they have technology that could spin it up quicker than anything we've seen, and then people being completely polarized. And I lead with that, saying that despite that, as we've said already earlier today, the vaccination is one of the key tools to get out of this, especially if you have congregate areas. So I think schools should, especially schools where you have lots of people congregating for hours on end, or any other business where that is a factor, the safest thing to go forward to get in front of a global pandemic is that everybody gets vaccinated. So I do believe there's public policy issues in the whole thing, like who actually then weighs in and has the ability to enforce it. So I think enforcement's a big piece in the public health side of what does that really mean? For businesses, if you're the employer, then that's the enforcement. For healthcare, with the state mandate, we have to comply given the regulations and how we receive funds. And so there's the enforcement. It'd be great to have a conversation on that level of having people understand the importance of how this will get us out of the current pandemic, and not about the variable information that is sorted and very polarized, that is just shooting us in the foot. So I'm not trying to pick on anybody. I'm trying to be apolitical here, but the answer here is that we are in a global pandemic still 18 months in, and we've been given a tool that can help us get in front of this. And absent everybody understanding that and participating, this just goes on longer, to the detriment of our communities, either in illness and or deaths. And we just don't want to see that.
Thank you very much, Dr. Diaz. Phil, you all set? Do you have another follow-up?
Just a quick follow-up. Have you seen any evidence in your organizations? It's only Monday, right? 3 days that the FDA moved to full approval of just one vaccine. But has that moved the needle at all in terms of your employees or others in your communities coming forward to get more vaccinated? And conversely, based on the mandates that you all have in effect, have you seen sick outs or people quitting, never mind the lawsuit, over the mandates, people disagreeing with it?
Oh, this is John Alexander. One of the things, and both Dr. Jarvis and Dr. Diaz touched on this, one of the things about this has been the fact that this has been a very difficult decision for a lot of people, whether they're healthcare workers or not. We've taken a lot of things that in medicine and in science, perhaps we take for granted as what we should do, whether that's wear a mask or use a vaccine to help prevent the spread of illness. And we've seen it become a very polarizing issue. And, those issues are very complicated. We've taken the approach at Central Maine Healthcare of really focusing on education and communicating directly with each one of our team members to try to understand where they're coming from. And where they're coming from is a lot of different places. So whether or not the vaccine is FDA approved, whether or not, frankly, there's a mandate, it's still a complicated decision for every single person who works in any of our organizations. And, as healthcare givers, it's really our job to use what we have available to us, whether that is the art or the science of medicine, and to help them come to a decision. Now, as I said before, and as all of us are on record as saying, there's no question that, getting vaccinated is, what we want everyone to do who's able to get vaccinated. But that doesn't mean that we don't understand when there are other people or people who can't, won't, are afraid to, fear the consequences of that process. So I think it's just really important for us to just remember that, I'll say it, at the end of that needle, that shot in the arm, there's a person with a family and a world of concerns. And I think we have to be considerate of them as well.
Thank you, Dr. Alexander. Thank you for your questions, Phil. We're going to move on to Fran Gonzalez now from Village Soup.
I don't have a question. You can pass over me. Thank you.
Great, thank you, Fran. Next up on the list is Emily Bader, I believe, from Lewiston Sun-Journal.
Hi, good afternoon, everyone. So my first question is for Dr. Alexander. We've heard from the other hospitals about the specifics of what the capacity or staff shortages are like, and I'm wondering what it's like at the 3 hospitals for CMH, and specifically where the staff shortages are. I mean, like, is it support staff, physicians in general, that sort of thing.
Yeah, thanks, Emily. So first, from a capacity standpoint, we have continued, like all the other health systems, so we've continued to try to fill every single bed and have had every single bed filled, staffed bed filled that we could. We are fortunate in one way and unfortunate in another, that there are always people who need our services. And so, our effort has been to really make sure that we can keep all of our services available to our patients in as timely a manner as we can. Clearly, we have a staffing shortage, not just here at Central Maine Healthcare, but in the state, that always impacts where we're at. We currently have 8 patients who have COVID in our main campus in Lewiston. We don't have any patients with COVID at our critical access hospitals in Bridgeton and Rumford. And we continue to work with each other and with our outpatient services to make sure that those patients receive the care that they need.
And do you have a follow-up question, Fran?
Yes, and thank you, Dr. Alexander. I wanted to ask Chris Laird, as a frontline registered nurse, if you're talking to a colleague about this healthcare mandate or just the requirement to get vaccines, what are those conversations like with your colleagues, or what would you want to communicate to them about this whole debate?
Thank you for the question. I think we have had a lot of conversations within our organization, within my units, and throughout the hospital with staff. Those conversations, as have kind of been described here, are individual for each person. Everybody has different concerns. Everyone has heard different things about what they feel about the vaccine, or what they have heard from family, or who they felt may have gotten sick. A lot of what we try to do is to truly listen to their concerns, because it is a person, it is someone that's there that we need to be able to support, and provide as best information that we can on why it is important. Because it is important not only to protect the staff that are here in our ICUs, but to protect our families that we go home to every day. It's important to protect the patients that we are caring for on a daily basis, as well as every one of those family members that comes into this hospital. So it's the important part that I try to convey is how truly important and how impactful it is on every individual that we come into contact to on a daily basis.
Okay, thank you very much for those questions, Fran, and thank you for that response to Chris. We're going to move on now to, I believe it's Alyssa Thurlow from WABI.
Hi, Chris. My question has already been covered. Thank you.
Okay, great. And getting towards the bottom of the list here, I believe I have somebody from Seacoast, but I don't know, I don't see Seacoast on my list. So what I'm going to do is, if you're from Seacoast, let me know in your chat what your name is, so I can track you down. Okay, Stephen Porter. Stephen Porter from Seacoast Online. We'll get you unmuted, and then you can ask your question.
Excellent. Thank you, Chris. My first question, I believe, is for Dr. Diaz, but I'm interested in everyone's response. Each of you have mentioned other factors besides just staffing and the tally of COVID positive patients. as affecting your bed capacity. Could you explain how much of the current problem is directly attributable to COVID diagnoses versus other factors? Or I guess to put the question another way, how does the current situation compare to past COVID waves?
Great question. So the actual number of COVID patients in our hospital right now are only 6. The issue, though, more globally from the pandemic, is that our nursing home staffing has been impacted by COVID. We can't open all our beds. And because there's still so much community spread of COVID-19, as soon as we get 3 positive patients in one of our nursing homes, the whole unit has to stop admissions and everyone get tested on a scheme over 2 weeks till we can open up again. And that's been playing out across the state of Maine and probably across the nation for the last 18 months. So without being able to transfer patients out of our inpatient units, people, instead of having a stay in the hospital, say maybe 4, 5, 7 days, they're here for 2, 3, 4 weeks. So if we can't open that inpatient bed, the ED can't bring those patients to the inpatient bed, so the ED gets backed up. So the bigger issue is just a global action of COVID, not specifically the acute illnesses right now. We are worried, though, that we see what's happening in other states, that, as always, I've been here a long time. As always, Maine is always at the end of the epidemic waves. So the wave you see in the Midwest and the South will come to us next. And I haven't looked at the numbers yet today, but I suspect that either today or next Thursday, when the case rates come out for Maine, that we're going to see a significant uptick given the activity around us. So that's really how I see the impact, and interested to see what my colleagues think of that.
Yeah, I echo the same sentiments as Steve. You know, we have a large number of individuals who normally would be doing their convalescence recovery or rehab at another facility, but those facilities right now are either full or closed or somewheres in between, and that makes it extremely difficult for us to manage. You know, last December, Eastern Maine Medical Center had a peak of 55 patients alone. We're not there. We don't want to go there. And as Dr. Boomsma said earlier, you know, none of us want to have to cancel, you know, non-urgent procedures or testing or things like that because of our case counts being higher. So certainly COVID plays a major role in that, and it's a multifactorial way that it plays a role, just like it is a multifactorial way that we decide what beds we have open for critical care versus medical surge or something else.
Okay, thank you for those answers. And do you have a follow-up question before I let you go?
I do.
Porter? Yeah.
Yes, thank you. I wanted to ask also about the financial impacts of all of this. So how has the pandemic thus far impacted your margins? And I really ask for 2 different reasons. One is we know that the reimbursement rates have notoriously fallen short of actual costs. And 2, we also hear some people in our communities claim online and elsewhere that there's a financial incentive for provider organizations to kind of hype the severity of the crisis or really maximize the tally of COVID patients. So could you summarize kind of the financial impacts or the dynamics as a layperson might understand them? And I apologize, I meant that for Dr. Boomsma.
Okay, thank you. Well, certainly I can say without pause that we are not making money on COVID patients. You know, the issue early in the pandemic when we were all, you know, in essentially a shutdown mode had a devastating effect. You know, we closed services, we stopped surgeries, we stopped all sorts of services. And by the same token, as we resumed operations, we also had to do so slowly. So it's taken a financial hit on all of our systems. I think that, you know, admittedly, we have gotten some federal funding. All of our health systems have from the CARES Act, and we're grateful for that. But we're still running in, you know, a negative. We're in a negative position from where we would have been were it not for the pandemic. And part of that is the way that reimbursement works from particularly the government, but commercial payers as well. Surgeries are highly paid. So when we do shut those down, it does have an impact. But the reality is that the reason that we're concerned is because our primary focus is on delivering care. And when we have patients waiting in EDs, when we have to put ambulances on diversion and patients can't get into hospital beds, then care is compromised. And regardless of which cases make money or don't make money, we're here to serve and provide that necessary care. And we're here today because we're all feeling like we are at a breaking point where actual care will be compromised if our hospitals remain at such a high capacity.
Thank you very much for those questions. We're going to move on next to Amy Brown from WERU. Amy, you should be able to ask your questions now.
Great, thanks, Chris, and thank you all for answering questions. First, I just want to say having all of you together from all the different hospital systems in one place putting out this plea is very powerful. So I wonder if you're planning to do anything maybe on television or social media together beyond our headlines saying that all of these healthcare systems are kind of coming together and calling uncle and encouraging vaccinations. And if there's more of a plan for you all to show a united front and put it out to the public about the point where we are beyond us going and doing that.
I think those are excellent ideas. I kind of want to see some of my colleagues on YouTube. The fact of the matter is that we talk on a regular basis. I think one of the things that everyone who's watching and listening should be proud of is that we're not talking about the competition between any of us. In the state of Maine, we look at each other as partners and as friends and colleagues, and we rely on each other day in and day out to assist each and every Mainer when they need help. And that should be something all Mainers should be proud of. That does not happen around the rest of the country. And certainly it wouldn't be that the 4 largest health systems in a particular state would have the conversations that we have or coming out and talking together. So I think if there's a take-home message from that standpoint, it's we are all in this together. We care about Maine deeply, and we want to see Maine stay healthy.
I just want to echo that, Jim, because throughout the pandemic, I think the strength of what we were able to accomplish in Maine was really because the 4 of us, and sometimes along with others, were in regular communication around beds, around safety protocols, around PPE, and ultimately around vaccinations. And we're back together again, and we're probably going to just form a garage band. So stay tuned.
Yeah, I was going to say, actually, I've been told I have a face for radio, so I'm not sure about TV parts, but
hey, we'll hook you up.
But more importantly, even before the pandemic, we used to talk amongst ourselves, noting that when one of us is full, none of us have the ability to weather a local hospital not being able to take care of its patients. So even before the pandemic, we'd have conversations like this, not as intensely as we have now, but there isn't a plethora of extra capacity in Maine in the hospitals as they are. So that's why we feel it so palpably right now. So just to put that out there.
Thank you. And my follow-up question is kind of building on that. Do you think, any of you, that it's time for the governor to declare another state of emergency before we get to, as Dr. Diaz was saying, Maine is always at the end of the epidemic wave. We've got kids going back to school. We know that's definitely boosted numbers in other places where they've already started going back to school. Should something be done preemptively so that mask mandates can be put back in place and gathering limits and other protective measures that can only be done under a state of emergency, or should we wait?
That is the million-dollar question.
Anyone want to jump up on that one?
Yeah, I'll just say that's a really good question. And I think it's also a very hard question. In some ways, if you do it too early, it takes away the ability to have people be compliant because they haven't felt or seen the numbers support what someone would do. So it's a fine line that you walk. So I don't want to speak for the governor or anybody else on this. I think it's a great question. I think the current answer I would have is, I think it's always an option depending on what is happening. The health systems are feeling it right now, but the community currently is not. So I think it might be a solution at some point. I don't know what the governor uses to make that decision. But from a community perspective, we're not seeing the massive outbreaks that we saw a year ago yet. I know you're saying, well, once the horse is out of the barn, what's the value? I don't know about that. And I am hoping that with Maine's vaccination uptake in general to this point, that perhaps that'll mitigate some of the rise that we're going to see. But reading those tea leaves is very, very hard. And as you know, the governor also took a lot of heat when she did the right thing, I think, and doing what she did. But that again was her threading the needle of reading all the data that she had. So I do not envy her job. I think she's done a great job. But I bet you that this kind of conversation is on her radar with her and her leadership.
Thank you very much for your questions, Amy. We have Eric Russell from Portland Press Herald, who's got some questions to ask, and I think he's going to be the last one. I do have a set of questions. Chris, you've been kind of quiet for a while, but I do have two questions directed from you as well that came up from Maine public that I'd like to ask you and have you answer. It's this. Generally, what types of services are you having to provide COVID patients right now, and how that differs from the pandemic? And just let us know what it's like treating those patients. Those are the two questions.
I think overall, we treat the patients to manage where they're at. We have patients, right now I have 17 patients in my ICU. We also have 15 that are in med-surg. So people are presenting with different needs, but the patients that we have right now in the ICU are some of the sickest patients that we've seen. They are critically ill. We have some patients that we are having to prone. They are intubated for long periods of time, and we're truly doing a lot to manage them and keep them alive. So it is really difficult right now, and we're providing a huge amount of resources to manage some of the patients that we currently have.
Okay, thank you, Chris, for that answer. And now I'm going to move on to, last but not least, Eric Russell.
Thank you, guys. Sorry, I know I'm double duty for the Press Herald, but I had a question that hasn't been asked, and it has to do with breakthrough cases. I know Dr. Shaw mentioned this a little bit on Thursday, or was asked about it on Thursday, and he said anywhere from 70 to 75% of hospitalizations are breakthrough cases, people that have been fully vaccinated. And I really want to be able to report on that in context, because I think people look at that number and they think, oh, geez, I would expect everybody who's in the hospital to be unvaccinated, right? What's the point of getting a vaccine if it's not going to keep me out of the hospital with the virus? So I'm hoping somebody can kind of address and put that in context a little bit about breakthrough cases and breakthrough hospitalizations.
Yeah, so I want to correct that. I think he said that 75% at least were unvaccinated. I didn't hear that, but I'm pretty sure that's what the statement was.
That's what I meant. Yeah.
Yeah, to be clear. So when we look at Northern Light Health across our entire organization, about 90+% of the individuals who are admitted for COVID-19 conditions are unvaccinated individuals. They represent the overwhelming majority of the cases that are sick enough to come into the hospital, and the sickest cases that Chris Laird just so articulately talked about, those are those individuals who are not vaccinated. And so I wanted to just be clear about that, and I'm sure Dr. Boomsma has the same sentiment.
Yeah, exactly right, Jim. I mean, we're about 80% of the hospitalized patients that we see with COVID are unvaccinated, and all of our ICU patients are unvaccinated. So we're not surprised, given the high percentage of vaccinated people in the state, that there will be some that either have mild symptoms or in some cases are unvaccinated. People are almost incidentally in the hospital for something else, and we do test everyone who comes in. So there are those breakthrough cases, but they're far and away not the sickest people that we're treating. And proportionally, it's a small percentage. This surge that we're experiencing now is being driven by pockets of unvaccinated individuals across the state.
Erica, is that your last question, or do you have one quick follow-up? Because we're a little bit over time.
No, that's it. Thank you so much, guys.
Okay, great. Well, thank you. Yeah, 5 minutes over for the amount of content we got through and the amount of people we had to speak. I think it's fantastic. Certainly want to thank Doctors Jarvis, Boomsma, Alexander, and Diaz, as well as Chris for their time today. And thank you, members of the media, for taking the time to share our story. We appreciate it. Have a good day, all.
Thank you all.